Welcome to Dermbusters, where we discuss common misperceptions in the field of dermatology and get some tips on how to counsel your patients. And I'm joined today by Dr. Anthony Rossi.
Hey.
Nice to have you here, Dr. Rossi.
Thanks for having me.
I've got a couple of questions for you. And the first one is, I prescribe clobetasol, tretinoin, topical tacrolimus all the time. And the patients tell me I want the highest percentage of ingredients. So is that more efficacious for them? What should I tell them?
It's a great question. You know, they're smart patients, obviously. So I always say you don't necessarily need the highest percentage of ingredients to get the job done. And in fact, as dermatologists, we probably think that just the right amount to get the job done is what we want to strive for. And I even think about this in cosmetic products, over-the-counter products. Certain ingredients are actually irritating at higher percentages, right? So if we think of something like vitamin C, which is possibly a weak acid, right? And if you have such a high percentage, you actually may be irritating your skin, especially if you're using it in the periocular area. And so I tell patients, look for key ingredients or active ingredients. They probably won't be the first ingredient listed, right? Because that would mean it's the highest percentage in that formulation. But it shouldn't be the last ingredient either, right? Because that means it's the lowest percentage in that formulation. You want to strive for something that's in the middle. In fact, we know at super high concentrations of things like vitamin C or other acids, they're just going to really irritate us instead of doing the job that they're supposed to do.
I love that point. The higher percentage, there's more side effects.
Yeah.
So everyone has to keep that in mind.
Yeah, for sure. Yeah.
The next thing is a social media trend I've been looking at about facial cleansers. And what I'm seeing is that you have to wash your face for 60 seconds with the cleanser to make it work properly. All my patients are telling me this. What can I tell them about this trend?
So I actually like this idea, but I even take it a step further because my biggest pet peeve is like, especially when people buy cleansers, we do need a good cleanser. And I don't think it's a great idea to just overlook your face wash, right? You can wash just with water, but again, it's not gonna do the job that you want it to do, especially if you're wearing makeup or other topicals, or if you live in New York City where you're bombarded by pollution every day, like me. So you wanna get rid of those environmental aggressors or pollution, hydrocarbons that's on your face. And if you just wash with water, it's not so ideal. But if you use a cleanser and you just put it on and wash it off, it's like washing with water, right? So the thing that we're looking for is contact time, right? So what is the contact time that's needed to have that active ingredient or have that sort of solvent in the facial cleanser actually work? So I tell my patients they should put their face wash on, actually get it a little bit sudsy, whether it foams or not, it's not a big deal. And I tell them to brush their teeth in between. So that might be a minute. Hopefully they're brushing their teeth for at least a minute, right? But it may be longer. And I don't mind them keeping the face wash on longer. I think it actually is doing the job it should be doing, and they're getting a bang for their buck, right? And they're not just washing with water.
I love that. So not exactly 60 seconds, but long enough to cleanse. And brushing their teeth is important.
Yeah, exactly. So you're killing two birds, one stone, I say. And you know, whether that's a 60-second contact time or a 90-second contact time, they're at least allowing that active or sort of the solvent in the face wash to do its job.
And you'll know who's using it because if no one's brushing their teeth, they're gonna have bad breath and you're gonna say, I could tell you're not using your cleanser properly.
Exactly,
so
yeah,
that's
totally.
An awesome tip. Last one is about sunscreen in the winter.
Yeah.
I think a lot of dermatologists know the answer, but how can I talk to my patients about using sunscreen in the winter, if it's necessary or not?
We get this question every day as dermatologists, right? So do I need sunscreen in the winter? Do I need sunscreen on cloudy days? And the answer, of course, is yes. We know that, but how do we get it across to the patient? So I like to show them that New England Journal of Medicine article.
Oh, that's a good article.
You know, with the truck driver that has the photo aging just on one side, because UVA gets transmitted through window glass, UVB not so much. But even in the wintertime, you can get significant amounts of UVA and UVB, and even on cloudy days, right? Because UVA will penetrate the clouds. So I tell them this, but I think a picture is definitely worth more. So I try to show them that if we have time. But I also say, like, let's say they're going skiing. There's so much light reflection and UV reflection from the snow or fresh snow, even more so than just getting exposure, you know, day to day. So if they're skiing, if they're outdoor playing sports, even in the wintertime, we want good UVA and UVB protection. So I say choose a physical blocker, anything above SPF 30. But also now look at the UVA indication too, because we'll be seeing on the sunscreens that they'll have the SPF factor and then the UVA protection factor. So that's going to be something to watch out for.
Awesome. As dermatologists, we all love photos.
Yeah.
So showing our patients that photo of the truck driver will really drive the point home that
Yeah.
you need UV protection all year round.
For sure.
Awesome. Thank you so much.
Good to see you.